This explainer is based on a chapter from the book Majhi Madhumeh Mazhe Niyantran, which means My Diabetes, My Control. For more details, please do visit www.schoolfordiabetes.in.
Hello and welcome. Today, we're going to pull back the curtain on the world of diabetes testing. We're going to break down all those tests your doctor orders and really help you understand what they mean for your health.
It's a question pretty much everyone asks, right? You go to the doctor, and next thing you know, you've got this long list of tests to do. It can feel like a lot. But trust me, there's a really good reason for every single one. And by the time we're done here, the why is going to be crystal clear.
All right, so here's our game plan. We'll kick things off with the why and how of all these tests. Then, we'll look at how a diagnosis is actually made and how you can measure your own progress. From there, we'll go beyond just sugar and look at other vital tests. And we'll wrap up with the most important part of all, your role in this journey.
Okay, first things first. These tests aren't just a hoop for you to jump through. Think of them as absolutely essential tools for your doctor. The results are what help them figure out a diagnosis, map out a treatment plan, pick the right medicines, and maybe most importantly, see if that treatment is actually working for you.
So all this information comes from two main places. First, you've got the clinical exam. What the doctor does right there in the office, checking you out, asking questions. And then you have the lab tests, where they analyze samples like blood and urine. These lab tests, well, they provide the hard evidence to confirm what the doctor suspects.
So, with that in mind, how does a doctor officially diagnose diabetes? Well, it all boils down to one simple thing: measuring the amount of sugar in your blood.
Two of the most common tests you'll hear about are fasting and postprandial, or PP. The fasting test, which you do after not eating for at least 8 hours, well, that gives a snapshot of your body's baseline sugar level. The PP test is done 2 hours after you eat, and it shows exactly how your body is handling the sugar from your food.
Now, what's so cool about this slide is just how clear-cut the numbers are. You can see right here, for a fasting test, if you're over 125, that's in the diabetes range. For a post-meal test, it's over 200. And that middle column, increased, that's pre-diabetes. Think of it as a really important warning sign. Now, because what we eat for a meal can be so different from day to day, the real gold standard for diagnosis is the OGTT. You drink a very specific amount of glucose, and then they test your blood 2 hours later. It just removes all the variables and gives a super precise measurement. This is especially crucial for diagnosing gestational diabetes in pregnancy. Okay, so let's say a diagnosis is made. The next huge question is, how do you actually know if your plan, your diet, your exercise, your medicine is working? Let's look at how we measure control. Before we talk about high sugar, we have to talk about the danger of low blood sugar, which is called hypoglycemia. As your levels drop, you can see the symptoms get more and more serious, from just feeling dizzy all the way to confusion and even fainting. The causes are usually pretty simple: not enough food, way too much exercise, or too much medication. It's a real balancing act.
And that brings us to what is probably the most important test for long-term control, the HbA1c. This isn't about what you ate for breakfast this morning. No, this test gives you your average blood sugar over the last 3 months. Basically, it measures how much sugar got stuck to your red blood cells, giving you the big picture view of how you're doing.
Now, here's the part that is just so powerful. You might think you need some huge, dramatic change to make a real difference, but the science tells us something amazing. Even a small improvement in that HbA1c number, just a single percentage point, can have a massive, massive impact on your health down the road.
And this slide shows you exactly what I'm talking about. A major study found that dropping your HbA1c by just 1% reduces the risk of kidney failure by 37%, a heart attack by 14%, and get this, the risk of amputation by an incredible 43%. 43! This is why that number is just so incredibly vital.
Now, while blood sugar is obviously the star of the show, managing diabetes well means looking at the whole picture. So let's talk about the other key tests that are all about protecting your overall health.
Next up is something called a lipid profile. It's a yearly test that checks the fats or cholesterol in your blood. It looks at the LDL, which is the bad cholesterol, and HDL, the good kind. Too much of the bad stuff can cause problems, but the great news is this is a risk factor that we can absolutely manage with lifestyle and medication.
Along with cholesterol, there are other really important yearly checkups. The UMA test is a simple urine test that can spot the earliest signs of kidney damage. An ECG is key for keeping an eye on your heart health, and of course, a regular eye exam can catch any issues before they become serious. So, we've talked about a lot of different tests, but now we're at the most important part of this whole conversation, your role. Because when it comes to your health, knowledge isn't just power, it's your greatest strength.
And this is the key message for everybody, whether you have diabetes or not. Diabetes can sneak up on you without any symptoms, so getting a simple blood sugar test once a year after you turn 35 is the only way to catch it early. And with some estimates saying 1 in 5 Indians could have diabetes by 2025, it's more important than ever.
So just remember, this is all a partnership. Your test results aren't a final grade. They're a roadmap. They give your doctor the information they need to create the perfect treatment plan just for you. And following that plan is the absolute best way to stay healthy and prevent complications in the future.
So, after learning all of this, understanding the why behind all the tests, the last question is really for you. Are you ready to take all this knowledge and take the wheel on your own health journey?